Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome back to part 3 of Lichen Sclerosus series of the Wellness Optimizing Warrior MD podcast. In this episode, I'm going to continue discussing the therapies available for lichen sclerosus. And I am really excited I was able to record these 3 podcast episodes, and I put a lot of thought into them. So if you know of a woman that is experiencing painful sex after menopause, because painful sex is the most common presenting symptom, please forward these episodes to her so she can consider discussing with her gynecologist whether or not a vulvar biopsy would be indicated for her. A vulvar biopsy, it's easy to do. It's easy to heal from. It will provide extremely significant high value in providing both the woman and the doctor with the knowledge that now they both know exactly what the problem is. This matters because lichen sclerosus is a condition which, if diagnosed early and addressed promptly, can be managed and contained and can be improved, and to the point where the woman is able to enjoy sex and have no symptoms. And in the last episode, I talked about topical steroids, I talked about tacrolimus, and I talked about estrogen therapy and testosterone therapy. Obviously, of all these therapies, hormones are my favorite, because I have literally seen the amazing changes that happen in a woman's body once her hormone therapy is optimized, not just replaced. That's a whole different topic for a whole different podcast, which I will bring to you soon, because hormone optimization for lichen sclerosus is key to achieve resolution, especially for this condition. Because when we consider hormone therapy, it's important that the hormone therapy levels are able to actually give a woman relief. But in this episode, let me talk about other options for managing lichen sclerosus, which is a very unfortunate and much more common than we believe condition affecting many women after menopause and impacting their sexuality. So I'm going to go right in and talk about option number 5. Remember, option number 1 was steroids, option number 2, tacrolimus, option number 3, estrogen, option number 4, testosterone. Option number 5 in treating lichen sclerosus is PRP. You might have heard of PRP. This is platelet-rich plasma. We can inject it into the skin, we can inject it into joints, we can inject it into the face, we apply it to help heal the tissues after a procedure, we can use it with microneedling for what is called vampire facials. This term has been coined and used a lot in the aesthetic world. But here's the thing. PRP can be injected to improve vaginal and sexual wellness into the G-spot, into the clitoris. That is, the name for that is the O-shot. It can also be injected into the area maximally impacted with the scarring or the plaquing or the redness and the inflammation caused by lichen sclerosus. And PRP is gaining a lot of popularity as a treatment option for lichen sclerosus. Well, why is that? Let me talk about the pros and what is beneficial about this procedure. Well, it is a minimally invasive procedure. Simply consists of drawing blood and then re-injecting the centrifuged gold serum on top of the sedimentation of the red blood cells back into the patient's body to be injected in the area of concern. In our case, it will be under the vulvar skin. Obviously, the procedure is reasonably comfortable, is done under topical anesthesia, using a compounded, usually benzocaine, lidocaine, tetracaine ointment for at least 20 to 30 minutes, which you numb the patient, you draw the blood, you centrifuge the blood, you wait until the blood centrifuge process is over, and then you're ready to do the procedure. Wipe the skin clean, prepare your injection, and inject. There is minimum recovery time after this procedure, maybe a day at most. The tissues injected could be slightly sensitive immediately after, and especially since women are not allowed to use non-steroidal anti-inflammatory agents like ibuprofen or Advil, they might be a little uncomfortable, but Tylenol is okay, and very few women need to take Tylenol. Now, why no Advil or ibuprofen? Well, we want to take advantage of the pro-inflammatory, pro-healing properties of the platelet-rich plasma that's injected in the patient's skin to help heal the lichen sclerosus condition. We do not want to stunt that process, and ibuprofen can do that. And I say heal, but I actually mean a temporary healing. It will not be permanent. That's one of the downsides. I'll talk about it in a moment. There's a variety of studies and observational evidence suggesting that PRP will improve the itching, the burning of the skin thinning, possibly promoting regeneration of a healthier skin in the area affected by the lichen sclerosus. So again, the PRP will have to be injected directly in the area impacted the most by this condition. Another advantage is because PRP uses the woman's blood, there's a minimal to no risk of allergenic reactions or an infection, which would naturally possibly could occur at the type of the injection and with an injection in general. But the risk is minimal because it's the woman's own blood. Again, there are very few side effects, usually some temporary discomfort for a few hours, maybe a little bruising at the injection site. 9 out of 10 patients feel there is significant benefit after the procedure. However, just like everything else, there are some downsides of the use of PRP for lichen sclerosus. Otherwise, everybody would get trained and everybody would learn how to use it. Number one is cost. PRP therapy can be very expensive, ranging anywhere from $750 to $1,500. It is considered experimental. It is not considered standard of care. Therefore, no insurance plan will ever consider covering it. One injection of PRP is not always going to result in an outstanding success. So many patients will need repetitive sessions, maybe once a month, 3 to 5 times in a row. That will add to the cost and is directly dependent to how does the skin quality present at the time of injection and how much improvement does it need. Now, another downside is the fact that unfortunately results could be highly variable, with many patients noticing a significant improvement in their symptoms and the quality of the skin after the PRP injection, whereas others barely notice little or no change in their symptoms after a PRP injection, which costs them money, which makes them reluctant to use additional sessions. They're like, well, if it didn't work for me, why would I pay more to get it done? Again, even as the doctor looks at the condition and says, this is pretty advanced. We might need 1, 2, 3 sessions. We hope we can get maximum improvement with one injection, especially if it's costly. But the woman on the other side of the receiving end of the treatment obviously is going to be frustrated when she spends money and she doesn't get improvement right away. So that is unfortunate. Now, another downside is the need for maintenance treatments. The benefit of PRP is likely not going to be permanent. It's going to require close follow-up, repetitive sessions once a year, maybe every 6 months for the first 2 years, depending on how aggressive the lichen sclerosus is. This adds to the cost, adds to the commitment, and to the effort on the side of the patient. And the patient has to put up with the somewhat minimal to moderate discomfort. The injections are pretty quick, under 5 minutes, but the patient has to put up with that because we can numb the skin, but they still feel the PRP going under the skin, and that's uncomfortable. And last but not least, PRP might be less beneficial or no benefit in older women. Why do I say that? Well, there are many reasons that you should be aware of because unfortunately, this lichen sclerosus condition impacts women that on an average are about 60 at the time of diagnosis. So one of the reasons, let's call it number one, is that as a woman gets older, her healing response will be slower. and her ability to regenerate tissue and to heal from anything will be significantly impacted. Unfortunately, older women will heal differently from PRP injections compared to younger women, and that's a fact. Number 2, as women get older, their available collagen and the response to the PRP injection with making new collagen will be decreased. You know very well collagen is absolutely vital for skin strength and elasticity, and lichen sclerosus impacts the skin integrity, affects its strength and elasticity, which will lead to tears during intercourse. So if the ability to respond to the PRP injection by making less collagen will be decreased, so will be the potential benefits of using PRP in women that are over 60 and especially over 65 or 70 years old. Number 3, older women are more likely to suffer from blood pressure problems, diabetes, immune system issues, as well as digestive problems, which unfortunately impacts their ability to absorb nutrients like vitamins and minerals, specifically vitamin C and others, I'll talk about it in a moment, which are absolutely required for normal healing and normal skin integrity. This will unfortunately impact the beneficial response PRP could have in an older woman when injected for lichen sclerosus. Number 4, last but not least, older women, not just in my experience, but probably in everyone's experience who uses hormone therapy, are never optimized when it comes to hormone therapy, even if they use hormone replacement therapy. And they think, well, I got hormones on board. I'm safe. I'm good. Why is it not working? Well, guess what? We need normal or optimal hormone levels of estrogen and testosterone to help heal the skin down there. That is why PRP is also probably likely to be unsuccessful in older women who are not healthy or optimally replenished with hormone therapy of both estrogen and testosterone. Number 5 reason why PRP might not work in older women is the fact that PRP contains a significant cocktail of growth factors like platelet-derived growth factor, transforming growth factor beta, and vascular endothelial growth factor, also known as VEGF. These are the critical factors which are required for wound healing and the tissue regeneration. This is what PRP is known for. Guess what? As we get older, aging will impact the levels and the availability of all these growth factors in a woman's serum, which is why super concentrating them is crucial to make a meaningful impact when PRP is considered in an older woman. This means it is less likely for the normal PRP processing to be beneficial in women over 65 to over 70 years old when lichen sclerosus treatment is considered. And that's probably likely for aesthetic treatments in joint as well. Number 6, a major critical factor to be considered when PRP is recommended is the individual variation of growth factor availability in the blood of older adults, meaning it varies from adult to adult. A woman who eats a super healthy diet, who has a very good nutritional status, and who does not have any chronic disease or autoimmune disease will likely have a much better baseline level of the growth factors I mentioned that are required for the PRP to be effective. So bottom line, a provider, a gynecologist who's treating a lichen sclerosus patient has to consider all the aspects of the health status of a woman before PRP is recommended. So if you make an appointment because Dr. X has been treating lichen sclerosus with PRP, and Dr. X does not ask you anything about your history and doesn't counsel you about everything I just told you, you're probably wasting your money. Number 7, last but not least, the PRP effectiveness is not just about how many growth factors are available after the processing of the blood, but it's highly dependent on the overall regenerative capacity of the individual, which means we need blood vessel supply to the area. We need an availability of vitamins and minerals that need to be there to support the repair and regeneration and the overall health of the skin. Just to summarize it here, Very briefly, what kind of vitamins we need, because I mentioned it earlier that we are going to need vitamins and minerals to have a good skin quality down there. And in order for PRP to be effective, we need vitamin A, which is a very important vitamin for skin healing and has anti-inflammatory properties, which obviously we want for the lichen sclerosus. We need vitamin C, which is a very potent antioxidant and is, as you know, absolutely crucial for the production of collagen. Collagen is what gives skin its strength and structure. We need vitamin E, which is also an antioxidant, reducing oxidative damage in the skin, highly beneficial in healing scars. We need zinc, which is very important for anyone healing their skin because it has a role in cellular growth and immune function, as well as it helps reduce the bacterial count around wounds. We need very good availability of omega-3 fatty acids, which maintains the skin lipid barrier and helps in the healing process. We need vitamin D, we need copper and selenium, we need iron. And last but not least, we need protein. And a good protein intake is absolutely necessary for collagen production and repair of the tissues. So, considering the possibility that the serum of a 60-plus-year-old and even older might not have the significant growth factors needed for the rejuvenation of the scarred and thinned skin of the vaginal entrance, might not have the vitamin, the mineral, and nutritional status required for the PRP to be beneficial, then what else can be done? Let's move on to number 6. And you might have heard about exosomes. And if you have not, and this is your first time, I'll just take a few minutes to explain what exosomes are. First of all, exosomes are a very useful alternative to PRP because they could work better in someone older whose plasma might not have so many growth factors and the PRP might not be successful. They might also be more effective in someone younger who has autoimmune disease, impaired nutritional status, and all kinds of problems. So how do they work? Well, exosomes are tiny vesicles released by cells, and their role is to facilitate communication between the cells by transferring protein, lipids, and genetic material. These little vesicles, let's call them transport molecules. They're derived from stem cells, and they can influence the behavior of the recipient cells, the cell that receives them, promoting healing and regeneration. So how would exosomes specifically help lichen sclerosus? Well, apparently they help improve the results of aesthetic treatments, and they're pretty much routine now in hair restoration, in med spas. They help joint injuries. Many people get injected with exosomes. Why would they not help lichen sclerosus? Exosomes promote tissue repair and regeneration by modulating local immune responses and stimulating beneficial cellular proliferation. We know that lichen sclerosus is an immune system problem with increased scarring, increased thinning of the skin, and loss of vascularity. Injecting exosomes locally, maybe applying them topically, could help reduce the intensity of symptoms or alleviate them completely in women with lichen sclerosus because it works by improving the skin integrity, quality, ultimately improving the skin elasticity and the skin moisture. The problem with topical is providing a specific ointment or a cream containing exosomes that has the capacity to penetrate the skin barrier. So when we talk about topical application, that's a limiting factor. And that's probably why injecting exosomes is likely going to be much more beneficial and is going to give the woman and the physician who actually is desiring results a bigger bang for their buck. Exosomes have properties that are anti-inflammatory. We know that lichen sclerosus has a lot of inflammation. Inflammation is the core mechanism through which lichen sclerosus causes itching, thinning, dryness, and ultimately the scarring of the skin. Exosomes hopefully exert immunomodulating effects. And we hope, we don't know for sure because there's no research done on this, we hope that exosomes are capable of stopping the inflammatory process, which could prevent the disease from progressing further and hopefully restore tissue integrity. We also think that exosomes might enhance collagen production, hopefully with the potential to reverse the thinning and the fragility of the skin affected by lichen sclerosus. Now, obviously, this is only experimental. Just like PRP, this is not and will not get covered by your insurance company. Again, even though exosome therapy has very promising potential, be aware that research regarding such therapy for lichen sclerosus is in very, very early stages. There will also be a significant cost associated with procuring the exosomes and the cost of the procedure. With a complete understanding, there is no standard of care, there is no protocol, we don't know how many treatments will be necessary, we have no idea. It just depends on the provider's experience, and it's let's try it and see if it works. Likely the cost is just about the same as PRP. For someone who is older than 65, someone who has significant medical conditions, exosome therapy would be preferable to PRP. So we talked about all these options, and I have one more to talk about. Everybody knows about peptides. So can we use peptides for lichen sclerosus? Well, peptides are the talk of the anti-aging and restorative medical world. There are indeed some very powerful peptides which could be highly beneficial in the treatment of lichen sclerosus. How would peptides work for lichen sclerosus? Well, we have peptides that have anti-inflammatory properties. So there are very specific peptides that can help reduce the inflammation. Lichen sclerosus causes inflammation. We manage the inflammation with peptides. We're done. We achieved our goal. So by reducing the inflammation, peptide therapy would alleviate the itching, the irritation, all the negative symptoms caused by lichen sclerosus. It would also minimize the tendency for scarring and thinning and will improve painful sex. We have peptides that can modulate the immune response. And we do know that lichen sclerosus has a significant immune, possibly autoimmune mechanism of action. And by helping balance the body's immune response, the peptides will potentially reduce the autoimmune component, which contributes to the development of lichen sclerosus. Now, the most well-known and studied immune-modulating peptides are the thymosin beta-4 and thymosin alpha-1. Actually, thymosin beta-4 is under investigation for possible benefits in the treatment of lichen sclerosus because it is known for its wound healing properties and is such a powerful immunomodulator. Another peptide under investigation is called LL37. It might be also beneficial in reducing the inflammation associated with lichen sclerosus. Now, my favorite peptide, which might be a significant tool in our toolbox in treating lichen sclerosus, is BPC-157. BPC-157 stands for Body Protective Compound 157. And it's a synthetic peptide that's gained a lot of attention because it has such an amazing potential therapeutic benefit when it comes to tissue repair and anti-inflammatory capacity. This peptide is well known for its ability to help heal injuries, any injury, protect the gut lining, help muscle and joint recovery, and we use it for a lot of things. The med spas, for God's sake, are using it now. There are no clinical direct studies connecting BPC-157 with lichen sclerosus. However, since this peptide is known as a healing peptide, it could offer some serious benefits in the treatment of lichen sclerosus. So I've started using it, and obviously it's completely full disclosure. This is experimental. It hasn't been tried before. But if a patient has suffered from lichen sclerosus for 15 years, and suddenly they have a flare-up and things are not going in the right direction, well, guess what? We will need BPC-157, especially if we're considering a laser treatment. It will help her heal and promote all the benefits of the laser treatment. So how does BPC-157 work? Well, it is known for reducing inflammation, one of the key mechanisms through which lichen sclerosus causes symptoms. BPC-157 promotes tissue repair, so it could help with the skin deterioration and scarring that is noted in lichen sclerosus. Again, this is purely speculative at this point. There are no studies available to demonstrate or sustain this hypothesis. BPC-157 could possibly help mitigate scar formation. Therefore, obviously, It should be highly beneficial in minimizing the long-term skin changes associated with lichen sclerosus. This condition has a serious scarring potential. BPC 157 promotes angiogenesis, which means it enhances blood flow and brings in new blood vessels to injured areas, which obviously it's a key process in helping heal the area impacted by the lichen sclerosus scarring. Whether BPC 157 in oral form, daily injectable form, topically applied form, or injected directly in the lesion would work best, is completely up to research to demonstrate and for the future to tell us. So in conclusion, I believe I have provided a lot of solutions which you might have never heard of. Please forward this series of episodes to someone who you believe might be able to benefit. Painful sex is a key manifestation of many skin conditions women have no idea they have. Lichen sclerosus is seriously underdiagnosed. It's estimated to impact 1 in 300 women, but statistics agree that it is likely underdiagnosed, misdiagnosed, and undiagnosed for a very large percentage of women. It is estimated that in true gynecology private practice, this condition could impact anywhere from 2 to 5% of the women seen by the gynecologist. Many couples find a way around painful sex. They engage in oral, manual stimulation, and this change allows them to enjoy intimacy and avoid pain. The treatment of this condition will require effort and commitment and communication between the woman, the physician, the woman and her husband, partner. It will require financial cost. So being aware and being educated about the existence of this condition and its options for treatment is crucial, so that women who suffer from lichen sclerosus or painful sex after menopause due to a skin condition, not just the loss of estrogen, can feel empowered to ask for a biopsy and ask for a solution like one of the ones I presented in this mini-series, which again is what I hope a highly valuable mini-series of episodes. Thank you for allowing me to be in your ear. What I had a lot of excitement in delivering, because personally I've seen a lot of women that are getting the diagnosis, are in shock over it, and 50% of women diagnosed do not continue to come back for the treatment. And there's a lot of fear around estrogen, so hopefully this fear will go away now that the FDA has removed the black box warning. There's a lot of unknown around PRP limitations, about exosomes, peptides, which are the newest things on the block. So hopefully women know that they have options, and timing of diagnosis with early action to prevent thinning of the skin and losing the quality and elasticity of the skin is crucial to prevent loss of sexual function. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.